I'll have more time with you guys. But as of now, yes, time for you to get what is Shah Rukh Khan's the new child, the baby boy? What's his name? Any guesses? No? You don't know? Okay,
Really though, but Abraham is the name.
Yes, Abraham is the name. We take down her name and... Knee bones or tail bones? Babies are born without what? No, that is not the correct answer. Well, huh? You're waiting for that? Okay, I'm going to change.
It's the cream or the rash and also Palmar's.
The nappy rash, right?
Nappy rash is different than diaper rash.
Okay.
It's the cream for diaper rash.
Ah, okay.
And Palmar's for nappy rash. Also, there is Infapol.
Uh-huh. In gynecology to please come up on stage. Yes. Here. Thank you. And last but not the least, I'd like to invite Famida Jaffrey, the clinical nutritionist and dietitian, up on the stage. Thank you so much. Trimester. What do you think would...
See, third trimester usually starts from the 28th week of cycle, 28 weeks of pregnancy, up to 40 weeks.
Okay.
So generally as the pregnancy advances, what happens, the space gets reduced and because the baby becomes bigger and the fluid level also starts reducing.
Right.
Because of this, generally the patient who feels very good movements feels less gradually as the pregnancy advances. This is quite common as with all pregnant ladies. However, some patients may not appreciate good movements. According to them, it should be the same. So whenever you encounter such patients who complain of decreased fetal movements or not appreciating movements properly, you counsel them this way. That generally it reduces as the pregnancy advances. And second thing is, they have to at least feel 10 to 12 movements in 12 hours. So if they are if they are a little anxious and they are not very sure about the movement, we ask them to keep a fetal kick count. So we ask them to keep a book and count the movements from 10 a.m. to 10 a.m. or 9 to 9, whichever time is convenient for them.
Okay.
And in these 12 hours, they will feel at least 10 to 12 movements.
Okay.
Roughly one movement for 1 hour, like that.
That should be good.
Yeah, but you have to counsel them that it is quite common as the pregnancy advances.
Right.
And this is the importance of fetal kick count when they are not appreciating the fetal movements properly.
Okay.
And in addition to this, we have a monitoring called CTG, which we can do if the patient is very anxious, and that will satisfy her, and also she will know what.
Like parents usually have this, the mothers especially, they're very concerned about it, that how much weight should I gain during pregnancy? That's the mother's genuine concern. So to that, what would you like to say?
Weight gain in pregnancy basically depends on how obese they are or where thin they are. It depends basically on the body mass index in scientific terms.
Right.
That is like in weight in kilograms and their height in meters it is measured.
Right.
And like it is called BMI. According to that they have to eat. There's some 2 obese patients like there are like 90 kilo, 100 kilo already.
Yeah.
We don't advise them to gain too much weight. So they have to restrict their weight gain. In whole pregnancy they can gain up to 6 to 8 kilos, that is enough for them.
Okay.
But if they are in like normal weight period, like normal between like 50, 60, 70, they can gain up to 10 to 12 kilos, which is normal.
Okay.
For them. So in that undernourished patient who are like just some 40 kilo kind of a patient, so they can gain even up to 18 kilos. So some patients may have diabetes, hypertension, depending on their condition also we do advise them how to manipulate their diets and how much they have to eat on how many calories, and it's not advisable to eat all kind of food in pregnancy. They have to be cautious about this junk food and all. What they are eating is very important. Right proportion of protein, carbohydrates, vitamins, minerals, fresh fruits and vegetables, and plenty of water. These are the things we advise.
Right. Okay, doctor, but how about exercising during pregnancy? Like people have this question, is it safe to exercise during pregnancy? What would you say?
Exercising in pregnancy per se, it's not, they don't have to avoid. And whoever is doing exercise from prior, they can continue with their routine.
Okay.
And aerobics also they can go for.
Okay.
Who are used to that. I don't say somebody who is not used to do that kind of exercises, strict, rigorous things. They should not start right now.
Okay.
But whoever was doing, who are physically fit, who can do, they can continue with that.
The baby and place it on the table where you are straighter with your back and you can change the nappy and you hurt your back less. So it's a way to control your back pain through modification of daily activities.
Absolutely. Thank you so much, doctor. Well, I'm quite certain that this is going to be one of those, sessions where you will benefit a lot out of it. So get your questions ready, because soon after this, I'm going to have your questions, discussing with the doctors. Okay, now.
And completely covering that, it's in danger. Means it's a major degree placenta previa. But if it is just extending low down to the uterus, it usually migrates upwards as the pregnancy advances. So most probably.
Thank you so much, doctor.
So low-lying placenta you need not be afraid of. Okay.
There are some structures which hold the tissue in place,
right,
and that is called collagen. Now what happens when during the pregnancy, when the uterus starts increasing in size, the skin gets over distended and the collagen breaks.
Right.
So with the break of the collagen, the marks that forms over the skin,
right,
that is called stretch marks.
Right.
Now what happens scientifically, there is no proven therapy for stretch marks.
Okay.
But like people have been trying many things. There are many. It has to work.
Right.
You have to start antenatally. Like when you are pregnant, that time you should start applying those creams. Some people even suggest olive oil is good.
Okay.
There are different ideas about it, but scientifically there is no proven treatment treatment for stretch marks.
Right.
And it depends upon person to person. Like some people, because the collagen is good, that it does not break so much,
Right.
so the stretch mark is less. So for some women, you might have very less stretch mark, and some women whose abdomen is really over distended, they'll have a lot of stretch mark.
Okay. Doctor, how about the postnatal exercises? You know, they say for weight loss, anything that you would suggest, you know?
Postnatally, actually, as the others explained, we expected to gain around 10 to 12 kg with the normal BMI.
Okay.
In the pregnancy, the weight gain is around 10 to 12 kg.
Right.
Now, what happens is, with this weight gain, like we have to lose that weight also. So postnatally, we have to lose that weight. Now, one thing we have to keep in mind is, along with the many benefits of breastfeeding, breastfeeding itself is very good to lose weight. See, each day we feed the baby, we lose around 200 to 300 calories.
Wow, that's interesting.
Yes. So it should be made in mind that many women, they tried some other substitutes for breast milk, but along with the multitude of benefits of breastfeeding, this itself is a good benefit. A woman who feeds the baby regularly, she gives breast milk, that itself helps her, and body is coming down to its normal pre-pregnant state.
Right.
So in that time, we advise only moderate exercises, but after 6 weeks, yes, you can, if you have delivered normally, you can go back to your normal exercises, and you can even have vigorous exercises even after that. But people who have delivered by cesarean section, we generally advise them that, wait for 3 months, let it heal completely, and then go for exercises.
Okay. Perfect. Thank you so much, doctor. Well, we are discussing here about the
into skincare. There's a beautiful phenomenon called the baby crawl, and you can look up all of these things online, and you work with your physicians in labor, you discuss with them antenatally that you have the plan to breastfeed. And when you're in labor and when you're in the hospital, you know everything that they can do to keep your baby with you after birth. So if they can put your baby on your chest, your baby will naturally find its way to you. The baby has a beautiful instinct to know how to find the mother, and the mother has a beautiful instinct when she sees her baby. When they're doing baby care, if your baby is healthy, she's breathing, she's crying, ask them to do all the assessments while the baby's on your chest. It makes the environment safer, and then the baby stays warm from your chest. And you can request this of your pediatrician and of your physician, and the hospital here is very supportive of that, which is a beautiful thing. And then the other thing that you can ask to do is to keep your baby with you for 1 to 2 hours, because within the first hour, right after labor, it's going to take a nap and you're going to take a nap.
Yeah, I just was coming to that. Does always, when a baby cries, does it always mean that the baby is hungry?
No, that's a great question. And no, actually, when a baby cries, it's actually a very late sign that they're hungry. So you do not want to wait till your baby's hungry. You want to remember to look for its hunger cues. So like an adult, when you're at a restaurant and you're like, hey waiter, can I get my food? And you're like happy and you're okay. And then all of a sudden you're really hungry and the waiter is ignoring you and you're like, I need my food now. And that's what the baby's doing when they're crying. So you want to catch your baby before when they're rooting.
Guidelines for the vaccination. We follow the DHA guidelines for the vaccination. As soon as the baby is born, we give BCG and hepatitis B, and then we tell them when to come at the age of 2 months, 4 months, and 6 months for the next set of vaccinations. And then next vaccination will be at 1 year, and then it comes to 18 months, and then at the 5 to 6 years of age. So usually almost all 99% they're all safe. But whenever they come for the vaccination, we do tell them about the side effects of the vaccination, which are very minor, but they should know about those things. See, there are a lot of diseases which are covered with the vaccines. First, we give vaccination for BCG and hepatitis B. And then at 2 months and 4 months and 6 months, we give vaccination for DPT, the hepatitis B, the Haemophilus influenza B. There are dreadful diseases which has to be covered. Which if we don't give the vaccination, they have the serious problems and they go for serious infections and they may die also. So these are vaccinations which are covered. There are more diseases, but it all comes in a single vaccine. Even though there are 4 diseases which has to be given, like DPT, hepatitis B, Haemophilus influenza B, but they are all combined in a single vaccine and single injection is more than enough for giving them.
Absolutely.
So there are not much of side effects. Usually at the time of giving injection there will be a small pain because of prick. Other than that, usually there will be some fever or some vaccinations, but that comes down by itself by giving some Panadol syrup or something like that. So usually most of the vaccinations.
Nutrient demands, and coming to calories, definitely a mother needs around 500 extra calories in a day when she is breastfeeding. If she is not breastfeeding, that's another case, but then again when she is breastfeeding, definitely that calories should come from healthier choices. Healthier choices in the sense, if it is like plus 500, it doesn't mean that it can come from KFC or pizzas. It should come from some healthy good choices, be it be fruit or fish, or including lot of nuts and seeds in the diet, low fat milk. It should be present so that needs are met during the postnatal period.
Right.
Obviously fluid needs are increased during lactation. It's always best to have lot of fluids which are not high in fats or so, but then nutrient dense, which can give you a lot of calories plus good amount of proteins and other vitamins and minerals, such as soups, which are vegetable soups, or probably smoothies, or some low fat milkshakes can be taken during the day. It can account up to around 3 liters per day, including water. It should not be all other fluids though, but water is an important beverage and the best beverage which can be taken during any period.
That is absolutely so true. What's the best food to cure constipation, after your delivery, after pregnancy? Like, people do complain. So what would you say to that?
Yes, constipation postnatally is one of the biggest problems mothers face.
Yeah.
It is maybe due to a lot of reasons. Psychologically, not moving around, movement is very less, and then again, even if it is a cesarean section, then she is really afraid to move around, and the intake also is very limited. Basically, constipation can be cured by many things, which
What's the best vegetables and fruits like good for pregnant woman that is having low hemoglobin?
Most of the quality iron content, which is like the heme iron, is present basically in animal proteins, okay, but then again the non-heme form of iron is present in fruits and vegetables. That means each day you should have some or the other in one or the other form of meat or its replacement. Red meat, lean red meat would be the best choice for you to increase the hemoglobin level. Fish, of course, is a good choice. Egg yolk is a good choice, but then again, if you want to try out with vegetable sources, even though it may not be completely absorbed, the best way is to include a lot of colorful fruits and vegetables. Green leafy vegetables, fruits like plums and dried fruits and nuts definitely have good amount of iron, okay. It will contribute to the increase in hemoglobin levels, and then it should be always clubbed with, taken with vitamin C, which enhances the absorption of iron in the body. Even though you may not be taking enough of iron rich foods, but then again try to include a lot of vitamin C rich sources like oranges, kiwi, bell peppers, papaya. All this should be included in the diet as a part so that you can increase in the hemoglobin levels.
Wonderful. Any more questions?
Another question for the babies. Okay, people say that
Second time pregnant, at least at an interval of 15 months. Second thing, all other things should be good. Like we look for the baby's presentation should be cephalic, baby should be an average size baby, they should not be very big, the placenta should be well positioned, and towards the end we look for scar thickness, that your previous scar should have a good integrity. So even if like on scan sometimes this shows a good scar, but it's the clinician's decision. Sometimes what happens, like even if on scan it is not foolproof. So it's like when your bladder is full, they check, they can see something else. When your bladder is empty, they check, they see something else. So it is not foolproof. Again, it's a clinical decision. The doctor can say only in the end whether you can be delivered normally or by cesarean, and she will palpate the wound, see for scar tenderness, look at your pulse rate, look at the fetal condition, and then decide. And thing is what even like when you are after a cesarean, we don't induce you, we don't give anything to induce a labor, but yes, we wait till the date to get, so that you get pain on your own. So it's like not recommended to induce labor. In the second, after a scar, not recommended to induce a labor, because if we induce the labor, those drugs might be too strong on the scar. In the end, we feel scar integrity is good. So putting all these together, if all these five things are fine, we deliver you normally. There are many women who have delivered normally after a cesarean.
Okay, madam. Thank you so much. Thank you. Any other question, please? Okay. Thank you. Hi, what's your name?
Hi, my name is Urvi. She's 17 months old.
Okay.
And her weight is 8 kg. Right since she was 13 or 14 months. And now she's 17 months and still she's 8 kg. So is this a point to worry about
So sometimes their weight gain won't be as fast because their stomachs are growing at the right rate. And so what we're used to seeing, you might think that, oh my God, other babies grow so fast, my baby isn't. So it's very important to consult with your pediatrician to make sure that what's good for your baby is happening, and it's not just, oh, I need my baby to gain more weight faster. So don't be surprised if a baby that's breastfeeding will gain weight at a slightly different rate than a baby that's not breastfeeding. But the person to consult with is your pediatrician. As long as the weight is right, they're urinating, they're pooping, they're interactive, their other growth parameters, their thinking skills, their ability to interact is growing, then that's a very positive sign. So sometimes then you can say, okay, we can give and take with the weight.
And now she's 8 kgs.
8 kg.
What was her birth weight?
3 kg.
Okay, so see, there are certain norms what you have to see. There's something called growth curve. If she's falling through the growth curve and she's not coming away from the growth curve, there is nothing much to worry about those things. So if she's away from the growth curve, if she's at the 50%, and since 6 months, if she's going down, if she's not up, going through the growth curve and she's faltering from the growth curve, that is the one which we need to worry. But we have to individualize all these things, because 17 months, 8 kg is a bit less. She should be around 10 kgs or 11 kgs at least. She's 8 kgs. So we need to check her. We need to see her, clinically we need to see if there is any other problem in her. And then we need to see her nutrition wise. If all those things are fine, and then if her development is fine and she's not having any vitamin deficiencies, mineral deficiencies and all those things, then nothing much to worry about. Because at the age of 1 year, after 1 year has happened, there is something called temper tantrums and there is something called food fuzziness. This is usually in all the babies. The more you try to feed, the more they run away from you. So this is one thing which you need to know about thing. As long as the baby is active, feeding well, there is no nutrition deficiencies, nothing much to worry. The baby picks up the weight by itself. But before that, once we need to check.
Dr. Manveer Singh, could we please have you on stage? Thank you. Could we have the prizes ready by then? Oh, such a small little baby. All right. Dr. Manveer Singh, thank you, sir, for joining us. Could we have the prizes ready, please? Dr. Manveer Singh will hand over the prizes to all these winners who have won today at Mums Day Out. This is all courtesy of Thumbay Hospital that we have here. Glenda and NAPCO gift hampers here up on the stage. So Dr. Manveer Singh will hand it over to all the winners. Could we all have a round of applause? You can do that much, can't you? Come on, clap, 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 clap. Woo! All right, so yes, one by one. Anita, please take your hamper. Thank you, clap guys, come on, some energy. Next, Sabine. Please take your prizes one by one. I still don't know you by your names yet. Yes. Okay, please do not go away. We'll need a photograph of you holding the hampers right up here. So just come back once again, please. Thank you. And if you could just assemble here so that the photographer could click you. After collecting the hampers, please come here so that we can take a photograph with Dr. Manveer Singh. You would need to ask Sumit. Just to speak to her once. Okay. Guys, after collecting the prizes, I'd request you please come here, assemble with something. Come on, smile. Yeah? Are we good? Thank you so much. Thank you so much. Well, I do have another winner. Number and buy it. 299 dirhams is what you pay for it, the advance booking payment. And then for the delivery, you pay 4,999. So this is what you have in store at the Thumbay Hospital right here. So once this is done, we'll have the raffle draw out, the names will be out, and we'll find out who's that lucky one to win the maternity package worth 5,000 dirhams. Let the music flow.